Hey everyone, it's Dr. Pimple Popper here, ready to tackle a condition that's more than just skin deep, atopic dermatitis, AD. It's a mouthful, right? But trust me, this is one itchy situation millions around the globe are dealing with every single day. We're talking about red, inflamed, itchy patches of skin that can pop up anywhere, driving people up the wall into their dermatologist's office. Now, you might be thinking, it's just a little eczema, right? Wrong. AD can be a real beast, impacting everything from sleep to self-esteem. It's our duty as dermatologists to stay informed and offer the best possible care for our patients battling this chronic condition. Think of this essay as your ultimate cheat sheet to conquering AD. We'll break it down from top to bottom, covering everything from its global impact to the latest treatment breakthroughs. So buckle up and get ready to transform your approach to AD. Together, we can help our patients find relief and get back to living their best, itch-free lives. Let's talk numbers, people. When it comes to understanding atopic dermatitis, or AD, the statistics are both staggering and enlightening. AD is a global health concern, affecting an estimated 20% of children and 1 to 3% of adults worldwide. This means millions of people from all corners of the globe are dealing with the daily challenges of this condition. That's a whole lot of itching. Imagine the discomfort and the impact on quality of life. It's not just a minor inconvenience. For many, it's a significant burden. What's even more fascinating is the variation we see in prevalence based on location. Some regions report higher rates than others, and this discrepancy can tell us a lot about potential environmental and lifestyle factors at play. Urban areas tend to have higher rates of AD compared to rural communities. This urban-rural divide is a key area of research, as scientists try to pinpoint the exact causes. Why? Well, the jury's still out, but theories point to factors like pollution, dietary differences, and even the hygiene hypothesis. The idea that less exposure to germs in early childhood might increase the risk of developing allergies and atopic conditions like AD. The modern lifestyle, with its emphasis on cleanliness and processed foods, might be contributing to the rise in AD cases. When it comes to age of onset, AD typically rears its itchy head in early childhood. This early onset can be particularly challenging for both children and their parents, as it often requires ongoing management and care. In fact, about 60% of individuals experience their first flare-up before the age of 1. This means that for many, AD is a condition they have to deal with from a very young age, impacting their development and daily activities, and a whopping 90% by the time they turn 5. These early years are crucial for development, and dealing with a chronic condition like AD can add an extra layer of complexity to childhood. But hold on, before you think you're off the hook, AD can also develop in adulthood, often triggered by factors like stress, hormonal changes, or exposure to irritants. Adult-onset AD can be just as challenging, affecting work, social interactions, and overall well-being. The takeaway? AD doesn't discriminate. It affects people of all ages, genders, and ethnicities. This universality underscores the importance of awareness and understanding. It's crucial to be aware of its widespread impact and keep an eye out for its telltale signs in patients of all ages and backgrounds. Recognizing the symptoms early can lead to better management and improved quality of life for those affected. So, whether you're a healthcare professional, a parent, or someone living with AD, understanding the epidemiology of this condition is a vital step towards better care and support. Let's continue to educate ourselves and others about AD, and work towards a future where its impact is minimized. Now, let's dive into the nitty-gritty of what's actually going on beneath the surface of those itchy patches. Understanding the underlying mechanisms can help us better manage and treat this condition. AD is a complex beast, involving a perfect storm of genetic predisposition, immune system dysfunction, and environmental triggers. These factors don't just act in isolation, they interact in a dynamic and often unpredictable manner. It's like a three-legged race where everything's gone wrong. Imagine trying to coordinate with 2 other people, each pulling in different directions. That's what happens in AD. First up, we've got epidermal barrier dysfunction. This is one of the primary culprits in the development of AD. Our skin's outermost layer, the epidermis, acts like a brick wall, shielding us from the outside world. It keeps moisture in and harmful elements out. But in AD, this barrier is compromised, much like a wall with cracks and holes. This makes the skin more susceptible to damage and infection. This allows irritants, allergens, and microbes to easily penetrate the skin, triggering inflammation and that oh-so-familiar itch. The more you scratch, the worse it gets, creating a vicious cycle. Next, we have immune system dysregulation. This is where things get even more complicated. Our immune system is like the body's security guard, protecting us from harmful invaders. It's designed to keep us safe from infections and other threats. But in AD, the security guard goes haywire, mistaking harmless substances like pollen or dust mites as dangerous threats. This overreaction leads to chronic inflammation. This triggers an inflammatory response, leading to redness, swelling, and itchiness. The skin becomes a battleground, constantly under attack. Finally, let's not forget about microbial dysbiosis. This is another key player in the pathogenesis of AD. Our skin is home to a diverse ecosystem of bacteria and fungi, known as the skin microbiome. This community of microbes plays a crucial role in maintaining skin health. In AD, this delicate balance is disrupted, leading to an overgrowth of certain microbes, particularly Staphylococcus aureus. This bacterium is notorious for exacerbating AD symptoms. This bacterial bad boy can further fuel inflammation and exacerbate AD symptoms. The presence of Staphylococcus aureus can make the skin more inflamed and itchy, worsening the condition. So, to sum it up, the pathogenesis of AD is a multifaceted process involving genetic factors, immune response, and environmental triggers. Each of these elements plays a significant role in the development and progression of the disease. Understanding these underlying mechanisms is crucial for developing effective treatment strategies. By targeting these specific pathways, we can better manage and potentially alleviate the symptoms of AD. Ongoing research continues to unravel the complexities of AD, offering hope for new and improved therapies. The future looks promising as we gain a deeper understanding of this challenging condition. With continued advancements in research and treatment, those affected by AD can look forward to a better quality of life. The journey may be challenging, but there is light at the end of the tunnel. Section 4. From Cradle to Adulthood, the Many Faces of AD. Atopic dermatitis isn't a one-size-fits-all condition. It can manifest differently depending on age. Let's take a closer look at its various presentations. For infants, in our tiniest patients, AD often appears on the cheeks, scalp, and extensor surfaces of the limbs. Think red, oozing, crusty lesions that are, you guessed it, incredibly itchy. As kids get older, AD tends to shift to the flexural areas, like the creases of the elbows and knees. We're talking dry, thickened, scaly plaques that can be intensely itchy and often lead to scratching, which, unfortunately, worsens the condition. Adult-onset AD can be tricky. It often presents with dry, itchy patches on the hands, feet, or trunk. Some adults may also experience lichenification, which is a thickening and leathery texture of the skin due to chronic scratching. Remember, AD can be a moving target, changing its appearance and location over time. A thorough understanding of these age-related variations is crucial for accurate diagnosis and effective management. Section 5. Playing Detective AD and its imposters. Now for the detective work. Diagnosing atopic dermatitis, or AD, is not always straightforward. It often involves a meticulous process of elimination and careful observation. Diagnosing AD often involves channeling your inner Sherlock Holmes. You need to be observant, detail-oriented, and thorough in your approach. While the characteristic features can point us in the right direction, such as the presence of itchy, inflamed skin, it's crucial to rule out other skin conditions that might mimic AD. It's essential to differentiate AD from other conditions to ensure the patient receives the correct treatment. Misdiagnosis can lead to ineffective treatments and prolonged discomfort for the patient. We don't want to jump to conclusions, right? A hasty diagnosis can be detrimental. Instead, we must consider a range of possibilities and systematically rule them out. Here are a few usual suspects to keep in mind. These conditions often present with symptoms similar to AD, making the diagnostic process a bit tricky. Seborrheic dermatitis. This inflammatory condition typically affects the scalp, face, and chest, causing scaly, itchy patches. It can be particularly challenging to distinguish from AD in these areas. Unlike AD, seborrheic dermatitis often has a yellowish, greasy appearance. This distinct characteristic can help in differentiating between the two conditions. Psoriasis. This chronic autoimmune disorder often presents with thick, silvery scales on a red base. The scales are usually well-defined and can be quite extensive. Psoriasis typically affects the elbows, knees, scalp, and lower back. These areas are key to identifying psoriasis and distinguishing it from AD. Contact dermatitis. This itchy rash occurs when the skin comes into direct contact with an irritant or allergen. The reaction can be immediate or delayed, adding to the complexity of diagnosis. It's essential to identify and avoid the culprit trigger to prevent future flare-ups. Patient education on avoiding known irritants is a crucial part of managing contact dermatitis. Mycosis fungoides. This rare type of cutaneous T-cell lymphoma can sometimes resemble eczema. Its presentation can be subtle, making it a challenging diagnosis. A skin biopsy is crucial for accurate diagnosis and appropriate management. Histopathological examination can reveal the presence of malignant T-cells, confirming the diagnosis. Remember, a thorough history, careful physical examination, and appropriate investigations are key to cracking the code and making a confident diagnosis. Each piece of information can provide valuable clues. Stay tuned for the next section, where we'll equip you with the tools and strategies to effectively manage AD and bring relief to your patients. We'll delve into treatment options, lifestyle modifications, and patient education to ensure comprehensive care.